everyone can enjoy this wonderful story. We would get new animals in each week. And so, of course, we would see a ton of parasites from all of the Humane Society animals that would come in, which is really good for our students to be able to study. But there were times where the parasites would not just come out, obviously, for us to be able to examine on fecal like flotation or centrifugation or whatever. We would have some animals that would once in a while like vomit up some like very long worms and stuff like that. So I'd be like, okay, that was enough for me to handle for today. So but yeah, so yeah, parasitology is really fun. But I also like to gross people out when we talk about like salt water and, has anyone ever gone into like the ocean? Yeah. Or you ever like accidentally swallow water, ocean water?
Oh no, I'm going in a couple weeks. I don't need that.
So there are like nematodes in ocean water. Now that you know, like, I mean, there are a ton of things, So my husband has a saltwater tank. So when I was teaching parasitology, I brought in some of his saltwater to like look under the microscope and be like, oh, let's, look at some of the nematodes that are just in his saltwater tank. So, I mean, there's a ton more stuff that you could probably look at under the scope from actual ocean water. But not only are there nematodes and other little critters too, right? But, you could see like little tiny brine shrimp and little crabbies like running across the scope and stuff too. So it was really, really fun. So just think of that when you go on your vacation trips. So they were fun. So that was a fun like little lab that we did. Just for funsies, and it grossed people out, but also made people kind of giggle. But so yeah, just take like, I don't know, you won't get sick, you'll be fine, it'll be good. I'm like, you could just take a dewormer afterwards. I don't know, your vets will be like, what are you doing? I'm just deworming myself, that's all. Okay, so I know we talked yesterday about some large animal parasitology that some of you guys were like, yeah, I kind of want to go over some of large animal parasitology. I figured we would start with, I feel like, the basics of parasitology and then work our way to the large animal aspect of parasitology. I say the basics because this is something that you definitely need to have a handle on and know forever. Not just ooh, echoing. Not just for the VTNE, but also in general. So so the first thing I wanted to kind of open up discussion was Dirofilaria emitis and what you guys know about Dirofilaria emitis. What is it? And what does it do? Let's start there.
Heartworm.
Heartworm. Great.
Lives in the pulmonary system, or the pulmonary vascular system, like the heart and the circulatory blood, blah, 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 blah.
Great. So where specifically in the heart, I'm assuming, are adult heartworms?
Ventricles.
Okay. Not necessarily.
The pulmonary artery.
They're in the pulmonary vein.
Okay. And where then And then okay, how long, I should say, does it take for the whole life cycle to, or for it to complete its life cycle?
Like 6 to 8 months.
Good range, yes. So it's, yeah, 6 to 7 months after infection, yeah. What is the life cycle that lives in the blood that we check for?
Microfilariae.
Very good. So, can someone describe to me or start describing to me the heartworm life cycle that you know? Or at least we can popcorn it if we get stuck.
Can it
Oh,
start?
one
rodent?
So it starts at, a dog, some other dog, and then what?
Well, I've heard that it can actually start in a rodent.
Okay.
And mosquito bites the rodent, contracts the microfilariae, and then the mosquito bites a dog or cat.
Okay. Sure. It could start in a human too. We could go that route. We could be like super rare case. You guys are like, what? You can get a heartworm? Yes, you can. It's just like you're a cat. Like we have naturally occurring antibodies to kill heartworm. But of course, there's like rare people, probably me, that would get heartworm and get sick. But yeah. So okay. So you have this mosquito, right? And it takes that ingested microfilariae of blood. And and then it has that infected microfilariae blood, and then it does what with it? I'm sorry, I missed. And then what happens?
Well, the mosquito carries the larva.
Okay. And then what stage is that larva?
Is it stage 1?
It is stage 1, but then at what stage would it infect the animal? What stage do our preventatives kill?
L3.
Good, L3, right? Very good. So, and so that takes that's like a 2-week period that we have of that L3 in the mosquito.
So it's in the mosquito from L1 to L3?
Correct.
Okay.
Yeah. I mean, not super, super important, but that way you guys kind of know. So yeah, bites are animal. And then we have our L3. And hopefully our animal has preventative, and so we can kill that L3 stage, right? If we don't kill that L3 stage. It then matures to what?
L4.
L4. And where does the L4 mature in?
Is it in the tissues?
Yes, in our sub-Q tissues, right? So how long does that take?
Like a month and a half.
Actually, just a couple days that it matures from L3 to L4.
Oh, I'm just thinking of L4 when they're full.
Yes.
Okay.
Yep.
Sorry.
Yeah. I'm like, you're on the next step, but yes.
Yeah, I'm sorry.
Nope, you're good. So yeah, from L3 to L4 is just a couple days. So then our L4 then migrates, yes, in through all of your tissues and reaches its sexually matured stages in roughly 50 to 70 days. So it is migrating through all of their tissues and finally reaches the heart and lungs as early as that 70-day mark.
Does it depend if it's male or female heartworms?
Yeah. So very good question. So what is so significant about our female heartworms compared to our male heartworms?
Aren't those the ones that show up on the ELISA?
Yeah,
Yeah.
they're the ones that give off the antigen, I believe.
Yes. Right. So, in how do I phrase this question?
Sorry, can we circle back a second? So
Yeah.
it's the female heartworm that shows the antigen on the ELISA?
Correct. Yeah,
Thank you.
absolutely. So, in cats, why do we typically not test for the ELISA test as much?
I was told that it gets into their lungs before it even gets into their heart. So it basically like strangles them before it even gets there.
Okay. We do test for heartworm in cats. We just typically do a different test for heartworm.
Isn't it the heat fix test that we do in cat? The heat fixation test? Because we do that a lot when we have like positive cases. So I didn't know if the heat fix was just a little bit more sensitive than the regular antigen test.
Okay. So what do you mean by heat fix, I guess?
Well, when we have, remember I told you that we do the heartworm protocol, and I even emailed it
Yep.
to you.
Yeah.
When there is a negative antigen test, like we send it to IDEX,
Uh-huh.
it's a negative, but it can still be a false negative. So then
Yep.
we turn it into a heat fix test. And sometimes even my antigens are negative, but my heat fixes are still positive. So I don't know if it's just because the heat fix are a little bit more sensitive than the antigen testing.
So heat fixing, do you mean like a slide prep or?
Oh, I don't know. I just send that stuff to the lab and they do it.
Okay.
So when you're ordering it on IDEX, the option is heat index, heat.
Yeah, you just ask
Heat
them if
fixing?
it's a heat fix test. There's a regular antigen ELISA, and then I use the same blood, and it goes and they heat fix it. I know they can do a filtration one. I guess that's the old school where you use.
They also do a modified knots.
right.
Yeah, yeah. But
Which I think
heat fix would still tell me a positive or negative, but I always do it as my backup.
yeah.
I do
There's-
get a negative
Yeah.
antigen on a positive heartworm dog. I always do a heat fix because with the studies they've done is that if the heat fix tells me it's negative, then they're negative. Because
Yeah.
it still can have some floating microfilaria, and it's just not enough to detect on the antigen.
Yeah. So are you in a southern state?
Yeah, we get it all the time.
Okay.
In Georgia.
So yeah, so it says
Everywhere.
here, it's a heat treatment of the samples. Prior to
But I think what it does, it heat fixes samples to
Right.
break up the antigens because they
Yeah.
clump. That's what my understanding is. But
So it says in southern states, samples from as many as 5 to 10% of dogs provide false negatives on results with antigen tests. So
yeah,
that,
we have like zombie mosquitoes or something here. I don't know.
yeah, so it says heat treatment of samples prior to testing results in detection of antigen.
Because I think what it does, it just breaks up the antigens to allow it to test a lot more
Yeah,
of a sensitivity to it. So
Right.
that's why if the heat fix says it's negative, then they're negative. If it's still a positive, but you can
right.
still have a negative antigen.
Yeah, I just think that's so crazy because it literally is like in southern states.
Yeah. Is that why you look at me
Like,
like, why are you heat fixing? I'm like,
right.
"It's not a thing."
Well, and I'm just like, you know, like we talk about heat fixing, but I'm like, well, what do you like? Okay, but what kind of heat fix, you know? So, I mean, like you said, like, heat fix what? Like what, you know, like, oh, the sample itself, like you're literally heat fixing the blood so that it, like you said, you're breaking up.
That's what we used to do.
the-
And then we would look under the microscope so it bounces around so you can actually see it moving more. And that's
Yeah.
how you could tell.
That's crazy. So yeah, it breaks up the formation of the antigen antibody complex, which is like crazy. See, I learned so much from you guys too. That's great. So yeah, that's awesome. So what I was going for in cats is the fact that cats don't have, see, that's why I like having those things, because where I was going with it was that cats don't typically have as many female heartworms as dogs do. So it's hard to get a positive ELISA test out of them. And they typically don't have as many heartworm as dogs. However, it still can be very deadly just by having a couple for them, as they can then throw an embolism just because if one dies off, they can then throw a clot or whatnot too. So yeah, it's extremely deadly for them in that case. So we do have to send out blood work for them that basically denatures the antibodies for them. So, but yeah, I guess that is more of the heat treatment aspect of it versus how we do it in-house for ELISA. Interesting. I did not know that was like for our dogs though, like due to the South having something different. Like
The zombie mosquitoes. It's what it is.
seriously, that's weird.
I've already had 4 cases this year.
Oh my.
Mhm. And one was in a 14-year-old dog. And I'm like, well, that's a prime time with LARPAR. So, which is,
Oh my gosh. Yeah. Well, and I mean, if you look at like the heartworm tests and stuff, like on the heat map here for everyone, like the South is just like crazy compared
She told
to,
me, she said, I was like, you use heartworm preventant? Oh yes, I've been using him all his life. I was like, really? Clove oil.
yeah. Ah,
I'm like, that's why he smells
Awesome.
horrible, but it's fine. I mean, it worked, right?
yeah,
It's fine.
yeah. Interesting. Yeah, and then so yeah, depending on like where you guys are, it kind of like varies, you know, of I guess of heartworm prevalence, right? So if you're on the West Coast, there are a lot of people on the West Coast that don't believe that heartworm exists in their area. I've run into that too, which is interesting. Which it does. There is heartworm out there. It's just not as common. But yeah, if you're in the South, it's very common. There are some areas, even in Illinois where I'm at, that heartworm can be pretty common, just not obviously as common as in the South. So it just really depends on obviously your mosquito. There's mosquitoes everywhere. I swear there are. So yeah. But it's important that we know the heartworm life cycle so that we can help owners know the client education aspect and say, okay, well, it takes this long, so you have to be able to give them their heartworm preventative on these many days. So you can't skip and think that that's going to be okay. So, I mean, it's better now that we don't have to give heartworm medication every single day like we did back in the day. I mean, I was just a kid when we had to do that, when my parents had to do that. But I mean, there's so many heartworm preventatives now that are out, that it's even nice that even if owners can't do it once a month, there's 6-month treatment that they can do, a 12-month treatment that they can do. So what are some of our heartworm preventatives that you guys see out there that maybe you utilize that you can think of?
Park Guard, Simparica Trio.
Okay.
Sentinel interceptor.
All right.
Roher.
Provecto.
Gotcha.
No.
Gotcha. So what are some pros and cons to some of these? Ooh.
They could puke something up.
Okay. Yeah. So pro to then the ones that we don't have to give orally is that they don't have to take it orally, right?
Yep. But at the
So-
same, the revolution too, if you have an animal that you bathe regularly, like frontline and stuff, I wonder if it reduces the efficacy.
If you bathe regularly, you said?
Yeah, washes it away because it's topical.
So that is important to know too. So if they put that on them, like how long afterwards can you not bathe them?
I was told that, like, we use multi a lot because it's in our heartworm protocol treatments,
Mhm.
that as long as the pet is dried and the topical is on for at least 2 hours, then it's effective. You can actually wipe it off after 2 hours.
Okay. I thought and that one actually they may have changed. So that one actually should be I think okay. I know the old one was I think 24 hours. I want to say Revolution is also 2 hours. So that's the nice thing about those is that it was a 2-hour thing. So I think you're right on that. Is that because that one is a newer one than the old version of them. So I'm
tell
sure
that to a lot of like the cat clients that like the topical because they don't know to put it up higher on the
Mhm.
neck, because I've had a lot of cats come in with foaming out the mouth and they think it's rabies. I'm like, no, he's just got it in his mouth, you know?
Yeah.
So I tell them to wipe it off after 2 hours.
Yeah. Yeah. So No, that's perfect. Like the fact, and then also how many of them are utilizing these to treat for fleas as well, right? So, which I know we'll kind of chat about too. So like, which ones are treating for fleas?
A trio.
Revolution.
Okay, Trio, Revolution.
Next card.
Okay.
I mean, no. Next card's the only one fleas. It's not heartworm. You want combination, right?
It doesn't,
Next card,
sorry, it
Spectra.
doesn't have to be a combination, but
No.
Sentinel, okay. Do we have Frontline in there?
We use Cordelio a lot.
We use Vervecto and Fidelio a lot.
Okay. How long does it take to kill fleas with them?
3 months because you have to kill the eggs as they hatch.
There you go. Right. I love that. How about your initial fleas? Your adult fleas, I should say.
Isn't
I
it like
love-
a couple hours? Within?
I feel like some products are a couple hours up to 24 hours.
Yep. What's our best one to kill them right away? Not right away, but the fastest.
Capstar.
Yep. What's the bad thing about Capstar though?
It only
Only
lasts,
lasts like
24
24 hours.
Yeah.
but you can put it in their butt if you don't want to stick it down the throat.
Really? I didn't know that.
Yes, you can do it
Mm.
rectally. It works, I promise.
We've had to do
Okay.
it on some dogs
Like-
before we do surgeries to get the fleas off.
Like, what's the worst? Like, come on, pick the better of the two evils here.
Put lube
Like,
on it. I put lube on it. It's fine.
but like, seriously,
It's fine.
if you don't want to put it down their throat, you put it down in their butt. Like,
Hey, I don't get bit.
who's gonna bite? But you're gonna get bit if you put it in their butt too.
No, I'm fast.
Proper restraint.
I know, right? Oh goodness.
Look, you're gonna think about that next time when you get a Capstar. You're gonna be like, should I put it in their butt?
No, absolutely not. I'm gonna be like, I'm sorry, you
And-
have fleas. I
labeled
would
for
never
it.
put this in your butt. I'm just gonna give
Like,
it to
it's
you.
labeled for it. I promise you it's labeled for it.
It was somebody who said, you know what? I am never gonna have to give this. So I'm just gonna label it for the butt too.
It worked, I promise.
I'm sure it works, but it doesn't mean it has to go that way. It doesn't have to go down that way. It's all right. It's all right.
You only just have, it's just,
It's a little pill.
it's a little pill. They don't even know it's there.
I can't do it. I just can't.
Dude, I do it all the time.
I'll think of you every time I see it.
You will, I promise. You'll even think about it when you have those.
I'm gonna make like a meme and put it on VTNE Prep.
Please.
I like-
But
I'm just gonna find like a Capstar picture and be like, Emily. With the rectal probe.
I'm secretly wanting a dog to come in now with fleas. just so I can
That's
tell
it. And you'll be like, guys,
goes in the
you know
butt.
where this could go? But I'm not gonna do it. Nope.
Well,
I'm
what
not-
if you get one of those cats that are just so hard to pill? You're trying and it keeps spitting it up, and you're like, I'm done. I'm done messing with you. Turn around. It's going in the butt.
Mm-mm.
Mm-hmm.
That
That's
is
like
the best
punishment.
sport.
What?
That's like punishment.
Killing a cat, it's an Olympic sport.
It is. And then and they can't really spit it out of their butt. So
And you say, here, little Kate, I got you some cheese.
no, not with those ones that are impossible. Even
I
with
love killing cats. I work in a shelter though with all cats, so
I'd be like, here's some cream cheese. Look at that.
who has cream cheese in their clinic? I got
Okay.
lube and I got my finger and it's
No. So I'm gonna get you some cream cheese. I'm gonna get you some cream cheese.
my husband's over here shaking his head at me.
So I just went to a clinic and they literally had an entire fridge dedicated to all their like fear-free stuff. And the bottom drawer, I thought in the fridge was like filled with like medication, like chemo or something. And I was like, what's in that drawer? And she goes, oh, it's all filled with cream cheese. All of it, cream cheese.
So cats like cream cheese.
And dogs, everybody, they love cream cheese. So, but think about it. If you spread cream cheese, like rather than peanut butter or whatever, but if you spread cream cheese, you know how hard that is to lick? They will be there all day. You could do your whole entire exam. You could do all your treatments. If you just spread
By the
cream
time you
cheese.
got your cream cheese and everything gone, that my capsar is already working.
But you had to go in their butt. You ruined their day.
Well, I've already gonna ruin them by doing fecals and temps and
No. No. Because you could do a
they
microchip.
don't know. And my
You could do
finger's
a
not that
microchip
big.
now that reads their temp. So all you gotta do is scan them every time. You scan them every time they come in. They don't even know you're touching them. So it's like a party every time they come into your clinic. You're having a party.
I'm just gonna put cream cheese in my pocket and just start handing them out to everybody. Lube
you-
also goes in my pocket.
Lube? You just carry lube around with you?
I got little packets of lube. You never know.
All right, now I know what you were having some sort of party when you're working.
Hey, I'm always prepared.
I'm sure you are.
I mean, they come home sometimes. Okay, I mean it happens.
I'm a little scared for your wash machine.
Yeah, really.
Fine.
All right. Well, now I'm gonna bring you some cream cheese when I come to Georgia.
Well, you are more than welcome. I live over here by Athens, so they call it the party city.
Yeah, because Georgia's one of my states I come to. So
Well, that's good to know. You should let me know when you're in town. You can come to my farm.
I definitely will. And I'm not gonna put any pills up your animal's booty either.
I'll do it for you.
I'm just gonna give them cream
I'm
cheese.
really fast. It's really fast. I promise. I have good aim. Serious. It happens all the time. I'm not the only one. All my doctors do it. It's real
Wait,
fast.
I have a question though. What about when the animal goes back to their owner? How much cream cheese is left in their buttholes?
No, we're
And
not
do they
putting cream
question
cheese in
it?
their butt. We're not putting cream cheese in their butt. Then the cat will be licking its butt the whole
I
time.
think there's a little bit of
Lick
confusion
my
going
arm.
on here.
No. Like, what if you forget which pocket and you think
Right.
you're going for the lube and your cream cheese in his butt?
Yeah, we're gonna have to write a protocol for this.
That's true. That's when you just put them in their care and be like, everything went fine.
Right. Yep.
If
Oh
they
my
even come in with a carrier, that's another story.
Oh,
Oh, I had a lady yesterday. I was helping reception and I just looked up and she screams, my cats, my cats. And I'm like, where's the cat? Thankfully, there was no other animals in the clinic at the moment. Cat booked to the back of the room, to the dog room.
awesome. All right. So, okay. So we have our fleas. Sorry, we got on a little bit of a tangent with my cream cheese and stuff. So with our fleas, we can do Capstar, and then we have a ton of different products that we can use. So, and then we're going to treat our Dirofilaria emitis we have so many awesome products now. We were talking about, we have ProHeart 12, which is great to be able to do once a year injection. Or we have a lot of awesome products on the market now that are oral or topicals. What is a really great one that you guys like currently that's out that is a multi-use, I guess, product, and why?
Empirica Trio.
Why?
It's easy. Once a month, takes care of everything. It treats puppies. It's just been the easiest. I feel like clients like it. The puppies like it. It's just the easiest to get protection for everything all around.
So what does it treat? You say everything. So what is everything?
Flea, tick, heartworm. And then I think some of them are coming up with deworming as well.
Yeah, the one we have up here on my side of the border in Canada, it does the intestinal worms, and it treats an extra type of tick, like, cause say the the next guard that we used to have would treat 4 types of ticks, but this Empirica Trio treats 5.
Great. So yeah, so Simparica Trio has 3 different medications in it, right? Because that's where we get the trio from. Correct?
What age can you start that? We don't use it. I didn't, because we're.
I think it's either 6 or 8 weeks.
Yep. It's 8 weeks of age, and your patient has to weigh at least 2.8 pounds. So it protects, so it's for dogs, and so it treats heartworm disease, ticks, fleas, roundworms, and hookworms. And let's see, it's a chewable, by the way, and it's FDA approved. I'm trying to think. So for fleas, it kills fleas as well before they start laying eggs. That's their claim, at least. It starts killing within 4 hours. So the drug that's in it to kill your roundworms and hookworms is pyrantel.
So it doesn't do whips, because it's really, whips are bad down here.
Yeah. Yeah, I know. I wish. I mean, pyrantel is not bad. I wish it'd be great if it had febendazole in it, you know, but it doesn't. So I don't know if I would want to have febendazole every month for my animal though, but I don't know. Yeah, you can't, I guess, necessarily do, I don't know if you can do like necessarily a 1-dose febendazole treatment.
That's the one that's in NextGuard, isn't it?
It might be, but
Because that's what we use in my clinic. We do HeartGuard, NextGuard.
I think it's NextGuard and Iverheart that has it. I think.
NextGuard, NextGuard does not have febendazole in it.
Is that fipronil then?
NextGuard is Afromalinol,
Oh, okay.
Flonexanol or something. HeartGuard is ivermectin and pyrantel. Most of them have, if they have a dewormer in it, most of them are going to have pyrantel in it. So what's so cool about Revolution? It's a revolution. is different.
Ear mites, heartworm. They have Revolution Plus now for cats for flea and tick. So it's got a nice myriad of, it's also a dewormer.
Yeah. So especially if you have outdoor cats, right?
Yep.
It's really good. So yeah, we mentioned ear mites, which is fabulous to be able to utilize. It's also great because it's a topical, especially for those who we can't give oral medication to and we're not able to give medications in their butt to be able to treat. So
I'm gonna get a shirt made.
yeah,
Now
definitely.
we use Advantage Multi. It's off labeled, but we use Advantage Multi for ear mites. It works like a charm.
Awesome. I was
Yeah.
like, if you say that you give that off
No, I
label
don't
in there,
give a little
that
squeeze in the book. No. Mm-mm.
I'll lose
No.
it and laugh. And then Revolution, do we say that this also treats for hookworms, roundworms as well? I forgot. For Revolution?
Is that the Revolution Plus or just regular Revolution?
Just regular Revolution, I believe. But it just says regular Revolution. I could be I could just not be reading. Oh, let me see. Let me read the dog one. Oh no, in the dog one, it's just in cats, you're right. They just don't, it doesn't say plus though on the box. So that's weird. So it's just in cats. They must have just relabeled the cat one.
Yeah, that's weird. The dog one only says Revolution, but it treats for ticks, but the original cat one didn't treat for ticks, but the plus now does.
Yeah, that's weird. And they're the same drug. Maybe it's just not labeled in dogs. Like maybe, because I know in like, technically ProHeart 12 is not labeled that it actually kills any intestinal parasites, but it has been noted that it can treat intestinal parasites, but they won't put it on the label because it's not like for certain that it does. So, or it's not, it hasn't been noted enough, at least in studies, that they can put it on a label. So maybe that's the reason why it's not on the label for dogs. So, what also in Revolution does it treat? Beep, beep, beep. So we have heartworm, fleas, ticks, certain ticks, and something else. I'll give it a hint.
Mites?
Yeah. What type of mite?
Is it scabies?
Yeah. Yes, yes, yes. Very good. So, I mean, we don't see scabies quite as bit as probably Demodex, but it's definitely helpful when we do need something for scabies. We had a huge scabies outbreak when I was in school, actually, in one of our in some of our animals, and then some of our students got scabies, so that was fun. Yeah. Okay, so anyone else have some favorites they like that they have used? while we're talking about some of these guys.
In general, or dewormers, or
Oh, sorry, dewormers.
heartworms
Dewormers
still
or
specifically? Oh.
yeah, so any of the
Profender.
preventative over here. So yeah. So it could
Profender
be
is great for cats you can't kill.
for which one? I'm sorry. Prevent
Deworming.
which drug? I'm sorry.
She said Profender.
Oh, Profender. Okay, thanks. All right. So what do
Sorry, I'm
we-
in a car, so I have bad signal.
No, you're fine. You're fine. So good. What do we utilize this for? Like, what does it treat?
We have it in our clinic. We don't use it much. We use it more for those that don't want the full heartworm flea treatment, but still want to have their indoor cat dewormed, like if they have kids or anything like that.
Great.
But for the longest time, our labels read that you have to do it quarterly per the CDC. And I never really understood why quarterly if it should be a monthly dewormer.
Got it. Yeah, honestly, I'm not sure why that is what the CDC says, or if that's just like their recommendations or what, you know?
Yeah, I mean, like I said, it says recommended by the CDC do quarterly. And I'm like, but why wouldn't you just do it monthly if you're already going to be deworming it anyway?
Right.
So
Yeah.
from my old Bayer rep, he was kind of explaining to us that with Profender, it was supposed to be marketed as a monthly dewormer, but because of the fact that the majority of the life cycle of these parasites was roughly 3 weeks, if you're deworming and it lasts for 1 month, you don't really need to redose over and over again, which was a poor selling tactic from my rep, but whatever.
Yeah.
But the really good thing about that was that it treated tapeworms. So in particular for those feral cats that we would have come in with for TNRs, it was really nice to apply if we didn't want to just give out praziquantel injectable left and right.
Yeah. No, absolutely. And I guess this is a really great idea too, especially since it's topical. And so if you can't give something orally as well, then you have something topically to be able to do. But yeah, that seems really weird to me as well, that they recommend a quarterly dosing, even if it's a monthly. I wonder what that, I don't know, that seems really weird. I don't know if it just has something to do with feral cats versus like indoor cats, or I don't know. I don't know, but that still doesn't make a lot of sense, like to me at all.
Me either, but I don't.
Yeah.
I just
Right.
print it.
But I think this is a really good one to keep on everyone's radar too, for those people, again, especially cats, because I feel like we do kind of drop the ball with our cat preventatives too, and even fecals in general with cats, as you know, like they need that extra care as well. Like we have better compliance with our dogs, but we don't do as much as compliance with our cats all the time. So yeah, this is great to be able to like give to them. So very good. Okay. Who mentioned, let's mention another one. Someone mentioned Bravecto.
That was me.
Yeah. So what do you like about Bravecto?
That you can technically apply it up to every 3 months.
Okay.
One of the vets that I was working with, she didn't per se like 3 months because I guess there's studies that have proven that within the last 3 weeks the efficacy of it decreases a lot. So she would recommend every 2 months.
Good.
But as a general, there were certain clients that just enjoyed implying it even if it was every 2 months instead of having to do it every month.
Yeah. No, absolutely. And so Bravecto, what do we use Bravecto for?
The fleas and ticks, I believe.
Great. Great.
Okay.
It's
Very
gonna
good.
have a better, like, wider weight range too. Doesn't it go up to like 123 pounds, while some, like the multi only goes up to 100 pounds, and then you have to add in like a 9 to 20 to make up for those really larger breeds too. So I think it goes to like the highest one was like what, 88 to 123.
Yeah, so it goes from, you have 4 pounds or 4.4 pounds to, yeah, 123. So it is like pretty significant to be able to dose out. So yeah, you have a pretty wide range to be able to do. And so like, and you have essentially 5 different categories within your dosing ranges. Versus like in some, they're like really weird on how they dose them out. So, but no, that's really nice to be able to do. And I agree, like, you know, like in some of the flea and tick products, like doing them monthly it's a lot to be able to do with heartworm preventative and flea and tick or whatever if they are separate. So this is kind of a nice like saver if you are if you don't have to do it every single month, even if it's every other month or whatnot. So that's kind of nice, especially since many people are now doing flea and tick prevention all year round compared to many years ago where they were just doing it during the hot seasons. So because we have like army fleas and ticks now that live all the time. So so no, this is perfect. Yeah, I know a lot of people that use Bravecto as well, quite a bit. Who mentioned Credello? Someone did.
I did.
All right, so let's talk about that one. Credello. What do you like about this treatment?
That's we use it for like our oral for those who don't like topical.
Okay. And what does this treat?
Fleas and
I think it's fleas and ticks.
Yep. Yeah, fleas and ticks. Good. And then and we can use these on our really young guys too. So 8 weeks of age, and then they just have to weigh 4.4 pounds or more.
mm-hmm.
And then if we're using this, how long does it take, do you know, for those fleas to start dying? We can make up a number if you don't know.
I think it's within the 24-hour mark.
It is within 24 hours. It's actually 4 hours.
Okay.
So yeah, we can give it, and this is a chewable, so they will hopefully, you know, eat it right away. Or you can put some cream cheese on it. It's fine. Or like, you know, anything. peanut butter, or like you can have a smorgasbord at your hospital, really. And yeah, give it to them that way. So good. Like, it's just crazy how many different medications are out there now that you guys all have to know, right?
Question, the Credello, is it a chewable or a pill?
Doable.
Yeah, chewable. Yeah. Chewable. Okay, so let's go back to 1997. I don't know, I just made up that number. Heart Guard. One of the OGs, right? Does anyone still use Heart Guard? I mean, people love Heart,
Occasionally.
yeah, people love Heart Guard. Like, people that have been using Heart Guard forever, like the diehard Heart Guard people.
My clinic, they swear by it.
Yeah. So some people will use Heart Guard forever and ever and ever. So there you go, right? So what's in Heart Guard?
Ivermectin.
Ivermectin, and then they threw in Pyrantel as well, right?
Mhm.
Because they were like, you know what, other people are using it, so like let's modernize Heart Guard. So yeah, ivermectin. So ivermectin is also like one of the oldest drugs we can use, right? So what does this treat?
Heartworms.
Heartworms, good. And then what else?
The rounds.
Rounds, and we have some hookworms with pyrantel. So it says 3 species of hookworms and 2 species of roundworms. Goody. And this is a chewable. For those of you who have never seen it before, it comes in like a rectangular cube. I shouldn't say cube, but you know, rectangular.
It's like a rectangular cube.
Yeah, it's a brick.
It is.
Yeah. So
I tell clients to break it up. So like some of those dogs, they just like inhaling things.
yeah,
So that I was told that it works better when they're actually chewing it as
right.
opposed to just inhaling it.
Yeah, very true. Right. Absolutely. And just FYI to those of you, so the ivermectin that's in here is a pretty low dose of ivermectin compared to like if you were going to give an ivermectin injection, like how we old school treated like heartworm or something to that nature. So we've had patients who have gotten into their Heart Guard box and like eaten multiple, Heart Guard doses. So owners frantically call us and are like, oh my gosh, they ate all their heart or, multiple Heart Guard ones or whatever. And we're like, oh my gosh, like now are they going to have ivermectin toxicity, stuff like that? Like it's still good to call poison control and stuff, but usually they're going to be fine just due to the dosing that's truly in there, that it's not like actually going to be super toxic to them. So yeah. Let's see.
Unless of course it's like a collie.
Yeah, and we actually, so you're right. So we actually, one of them was a collie that had done that before, and it still was a pretty like low dose for that. So yeah, it wasn't anything that they were concerned about. So it said that the the side effect that they see the most in this was vomiting and diarrhea, and that was rarely observed by 1.1% when they see it. And that, of course, they have to put in here that the adverse reactions on there is your depression, lethargy, vomiting, anorexia, mydriasis, ataxia, staggering, convulsions, and hypersalivation, which is, you know, for MDR1 mutants, as I call them, because we still have to be cautious, right? But that's why it's really important to at least call your poison control just to make sure that they're going to be okay. I think it's always good, just like I have a border collie. Now that we have the capability of doing our DNA testing, that's super simple for MDR1 mutations. I always recommend like doing that on our collies just to know like what their sensitivities, if they are going to have any, are, so that, hey, if they are going to be sensitive to a drug, let's not put them on ivermectin or metronidazole or some of these other drugs that are going to be sensitive to these guys, you know, or acepromazine or whatever. And then choose something else. We have a ton of different drugs that we can put them on. So then we don't have to worry about this stuff. So yeah, I'm still waiting for my results back for my dog, actually. So it does take like 6 weeks. So yeah. All right. Any other drugs before we move on here? Oh, one other one is Sentinel that someone mentioned. Sentinel is pretty old, but I actually really like it. Which Simparica Trio is Sentinel is part of the trio, by the way. If you did not know. So someone mentioned Sentinel. Who mentioned Sentinel?
I did. We use it a lot.
Yeah, so what do you guys use Sentinel for? What is a treat?
Heartworms and deworming.
Okay. So heartworms, and then what are we deworming?
I think it's all round hooks, whips, and tapes.
Good. So yeah. Rounds, hooks, whips, and not tapeworms. No. It prevents the development of flea eggs, though.
Right. Yeah.
Yeah.
A lot of people use it for like solely flea control, but we have to tell them it's just like the eggs that it.
Yeah. Which I would be totally down with, because you can give Capstar and then, like, you know, for that portion, control of your eggs, and then I would like overdo it, right? Because I don't want to deal with fleas. That's a pain. And then put a topical on that or something, or, you know, whatever, if you're using a Sentinel. So, but no, that's perfect. So, in these guys, you have to start. So these guys, you can start pretty early. So, they have to be at least 2 pounds. And you can start them at 4 weeks of age or older. But yeah, I really liked Sentinel for my animals.
Is it topical or a chew?
It is a tablet form, but the tablet is flavored, so I will say that most of my animals ate them. but I also had weird animals that eat everything. But that's because I put everything on it. I'll put yummy food on them. I don't stick it up their butt. They're tiny tablets too. So that's kind of nice as well. Like, so if you have like a smaller dog too, that they don't like with HeartGuard, they're for a small dog, you have to make sure they eat that whole brick of HeartGuard. So this is kind of nice because it's like a little tiny tablet that they can eat. So. All right. So if we were to talk about Diblydium caninum. So we were just talking about fleas, right? So we're gonna follow our flea a little bit. So Diblydium caninum and the flea intermix because the flea is the intermediate host, correct? Or no, am I talking crazy talk?
Yeah, you're right.
Okay. I'm like, it's been a long time, guys. So just someone describe what Diblydium caninum looks on a microscope.
Looks kind of like a hookworm, but doesn't it have a thinner outer shell?
Yes. It has a thinner outer shell. What's on the inside?
The eggs.
Okay. So how do I differentiate a hookworm from Diblydium caninum?
The inside of the tapeworm is like more overly packed in the
Okay.
thinner wall.
Yeah, and then the little egg packets, they're pretty what's on the inside of the egg packets that you should be able to kind of differentiate?
Is it the future hooks of the tapeworm?
Yes, 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 yes. Very good. So if I have my big Diblydium here, I'm gonna have my like eggs all here, right? I'm not gonna draw all the hooks in here, but how many hooks do I have?
3.
3 sets of them. Like that. So you should be able to make these guys out in each thing. Right? And so you're right that in here, this like egg sac is more defined than in hookworms. it is a little bit more mushy looking, right? Now, when we, now what's our life cycle for Diblydium caninum? Like I gave you the intermediate host, all right. But like, how does that look?
The dog has to eat the flea for it to become
Ooh.
contaminated.
Mhm. So yeah. So if you have an animal who has fleas, it's probably a good idea to also do a fecal test at some point, right?
All right.
Yeah, okay. And yes, you're right. They have to ingest the flea in order to have Diblydium caninum. And so when the tapeworm forms, how does the tapeworm, I should say, where does the tapeworm form and how does it form?
The small intestine.
Good. So it hooks on to the small intestine, right? With
Right.
its little crazy grabber guys there, right? And then, yeah, what else? How does it form?
In segments.
In segments, right? What are those segments called?
Proglottids.
Proglottids. So it's my amazing drawings. So you have these, so it starts like this little baby and then it has these proglottids that form. So this is our tapes, right? So the proglottids. And so finally, as it ages, it says, oh, I need to like reproduce myself. So it breaks away some of these proglottids and this is what comes out, right? Out of feces and whatnot, because it goes out of the GI system altogether. It moves through the GI tract. And so how does this appear to us? Like, what does this look like?
Grains of rice.
Yeah, grains of rice, whatever, you know, stuff like that. And so how do we then, or how should we diagnostically look at this? Or have any of you guys diagnostically looked at proglottids at all?
You crush them up with a little bit of saline and then you look under the microscope.
Yeah, so much fun. You're like, that's one way to describe it. And so have you done that? What does it look like?
I've done it in school. It looks like you can really see the different egg packets when you do that.
Yeah.
Looking for the difference between like Tania type and Diploidium.
Okay. So you definitely can see a lot more, especially of your Diblydium, right? Because these are essentially your eggs. So it's essentially like reproducing itself. So that way it's a diagnostic way to look at it, right? So yeah, you're opening up these proglottids. So yes, by taking a little bit of saline and then because by the time it comes out, it could be just like sitting there and drying up. So you just want to re-wet it, you know, and then open it up. So, and then you know, you could just wet mount it or whatnot, and look at it. And then you look at it and then you can treat your patient then. So now, yeah, and you can look at for tinea or debilidium as well, like you mentioned, tinea. So what does tinea look like? Because you mentioned tinea to me.
I think it's called oncospheres is what they call it. It's like it looks like a sunshine kind of rays.
Okay. And so we have, so you have like kind of this like outer, I'm like the world's worst drawer. So you have this like outer packet or outer, sorry, outer shell, I guess, of the, and then, yeah, it like has this like nice little, it's like bright right here. And then what's important is that kind of like this cytoplasm area is a little bit darker, but the important part is this inside has what on the inside to be able to differentiate.
The hooks.
Yeah, the hooks again. So the cell wall here, that's what I was trying to think of. The word cell wall is thicker, right? And then this is really bright. This inside part is really bright. So like how you said, that like sunshine effect. But you have these hooks. All right. So we do have one other type of tapeworm that's different. What is that one called? And for some reason, I just like the name of it. I don't know why I like the name of it. It is like, it turns out to be a cyst. So you have Echinococcus granulomus, but it turns into a hyoid cyst. Has anyone heard of that?
Yeah, now that you say that, I have a little bit.
Okay. So you guys have to look this up and watch like a YouTube video of it at some point. Because it's really interesting. I'll put it as that. So it's called a echinococcus or a hyoid cyst. So this happens more often in like third world countries, like humans, but can happen a lot more in like animals, of course. But it happens when you have like poor meat quality, stuff like that. And there are tapeworms within like meat. And then the tapeworms can potentially, obviously, create a cyst somewhere within your abdominal space. And so, or I mean, there have been hyoid cysts anywhere. Like someone had one like in their brain. So I saw a video of that because, you know, I watch weird YouTube videos and show them to my children because I'm weird. But anyway, the bad thing is that in order to get rid of these, is that you have to have them surgically removed. And the really hard part is that in order to surgically remove them, you have to be very cautious that if you break open the cysts while you're surgically removing them, it creates an anaphylactic reaction and the person can die. So if you guys watch a video and see, it's like super, super fragile because some of these cysts can be like really, really large. And there can be like in some of the videos I saw, like 50 of these cysts just in someone's abdomen, and it's truly just like tapeworm eggs that are sitting there. So these are the things that we in where we live are very fortunate that we have pretty clean food sources that we don't have to worry as much about, and we take advantage of, I guess, or I guess we are just like very privileged that we don't have to worry as much. But these are things that we can potentially see in some of our animals that we have as well too, that we do have to keep in mind. It is rare though in our animals even, but it's not something that we shouldn't take out of our mind that it could happen, right? But again, that is rare in even our animals, but it does happen in third world countries is also something that is hard to even imagine. So I definitely recommend you guys checking that out to see what it looks like. So yeah. So that is one thing as well. So you have those 3 tapeworms. Now, what is tapeworm also referred to as a category?
Cestode.
Cestode, very good. So treatment for our cestodes usually are what type of drug?
Praziquantel.
Yes, absolutely. Good. So you guys are on it. Awesome. So, and it's the same thing like in large animal too. So if you had a large animal, they would treat for the same. Okay. So let's go quickly to some flukes as well, because flukes are always fun, right? So what are flukes called?
Trematodes.
Yeah, or trematodes. We can call them either or. So don't worry if you think you say it wrong. You're not. Everyone says things different, right? All right, so there's a certain type of trematode that is, let's see, which one do I want to go for? There is one that's intermediate host is a snail. Anyone? This one is kind of one that we talk about a little bit more frequently. I don't know why we talk about it that much more frequently.
Is it Fasciola hepatica? Or is that the crayfish one?
No, Fasciola hepatica. No, the crayfish one is
Sorry, that's
oh, you're
the
okay.
lung
Yeah.
fluke.
Yeah.
Okay.
Sorry, this one I'm thinking of, it has 2 intermediate hosts. It is, the first one is a snail, and then the second one is the crayfish.
Paragonimus kellycodi.
Yeah, you looked it up.
No, I had Sam.
Oh, okay.
For parasitology.
No, perfect. So this one is talked about a lot. I personally, so funny thing is that I don't live anywhere near where there are snails or crayfish. So I don't know, not something that I run into a lot. So so I have not seen this, but it must be something that is seen quite a bit because I know that we talked about it a lot in school. So yeah. So yes, when we talk about Paragonymous keletiaki, it is first shed, obviously, in their feces. And then the eggs of that hatch in water. Okay, so obviously our flukes are in water, right? That's the general idea of flukes, is that they're near water. And typically flukes like to have intermediate hosts, and they like to have at least one, if not more. So that's the fun part of flukes, is that you have to know their intermediate hosts, and then like the life cycle of them in all the different ones. So the first intermediate host is the snail, and then it develops it into its stages in the snail, where then it goes and infects the second intermediate host, which is the crayfish. And then it goes to dogs or cats and infects them. So itself, when we talk about what it does, is that it develops into the lungs of dogs and cats. It can be asymptomatic in these animals, or it can cause respiratory signs as well. So you can see like coughing, they could have trouble breathing, you may see even a pneumothorax. You could see like just a decrease in the amount of like their bronchi being able to take in air, like stuff like that. So so that's the main concept of that trematode right there. Let's see. How about anyone live in Florida? Or Hawaii?
I do. Hawaii.
I have
Yeah.
I knew I had a Hawaii person. There is a fluke from cats that can cause some liver issues and an enlarged bile duct, gallbladder issues, that kind of stuff. Do you know what that might be?
Is that the fasciola hepatica? Okay.
Absolutely. So yes, can lead to, of course, enlarged bile ducts, gallbladder issues, and ultimately liver failure as well. And how about, oh gosh, let me see. Trying to think which one may be really important. I think those are the big ones. Oh, this one's good. Okay. Oh, I think that's good. All right. We'll go with our roundworms really fast. Okay, so these were probably what the first ones you guys learned in roundworms, right? So what are our roundworm species called?
Those are nematodes.
Okay. And then the species of roundworm, what is that called? Four, I should say, there's technically two, but or common.
Aren't those the round and hook?
Okay. Yeah. So what is the species called for?
Coccidias?
Sorry, what?
Toxicara canis.
Yes. Perfect. And then there's another there's another one as well.
The Toxicara, the Gandhi one, the toxoplasmosis, or no, that's not the round one.
Yeah, I know. There's one that is
Patai?
no, this one's just not as common.
Are you talking about Uncenaria, Stenocephala, or Toxoscaris? Leonina.
Toxosaurus leonina. Yep. Yep. Toxosaurus leonina. No, leonina. Leonina. So we have Toxocara canis, Toxoscaris whatever. Leonina. Right? And then we also have our raccoon roundworm. To just like take note of just
Which is the Leonina one? Which animal gets that?
We'll get to that.
Okay.
We'll get yeah. I just want you guys to have those terms right now. And then we have our raccoon one as well. So what's our raccoon one?
Baleascaris procyonis.
Very good. Very good. So it's occasionally found in dogs. So that's kind of why it's good to know that one, which this is good to know for the VTNE. That's why I kind of bring it up.
How do you spell that though?
BAY, and then it's Lisa, LISA, SCARIS.
Thanks.
Yep. So yeah, this is good to note. And obviously, just kind of looking at the difference between Baleascaris and then Toxocara is good to just note too. Like they're very similar. You can definitely see that, yes, they both are a roundworm, but they are different. So when you guys have a chance to like just look at the differences, they're really good to take a peek at. Okay, so when we're gonna chat really quick about the other two. So when we have these guys, so our roundworms, so when we are talking about our ingested, when our dogs are infected with our ascarids, so our roundworms, right? So those are interchangeable. They can be ingested of the eggs from a contaminated environment or from also other methods, sometimes placental transmission as well. So that is just from Toxocara though, okay? So Toxocara can be from ingestion or transplacental. So this is when you guys learned horizontal versus vertical transmission, right? So what is horizontal transmission? Which one is that?
Ingestion.
Ingestion, right? And then vertical would be transplacental. How do you remember that? Or do you just memorize that?
I think of like vertical, like a picture comes in my mind of like a straight line going down to like your family tree. Like, so it's like mother and then like puppies. And I think of horizontal, like a horizontal line between like a separate animal from like a different, like if you wanted to go to a different family tree, you'd have to go all the way across horizontally, and that would be a different animal that's not from the same branch, if that makes sense.
Got it. You don't have as dirty of a mind as I do. I think of me eating horizontally, right? So like I eat on a table, usually. And you give birth, I mean, in the olden days, like not anymore, unfortunately, because we have to, but if you give birth vertically, right? Like there it goes, vertically. So yeah, that's how I remember. We were very creative when we were in school. So we came up with like the weirdest things to remember. We're like, okay, if we give birth up and down, right? So that's vertically, and then horizontally, we're like eating like on a table. So that's how we're going to remember it. So that's helpful. But I like the family tree idea because you're right, going up and down as well. So I like that idea too, if you don't want to be gross like me. So very good. That's another thing to note too, is horizontal versus vertical transmission for VTNE. They ask you the craziest thing if that's where. Okay, so then for like I said, Asacaris is, or Toxocaris is not transplacental. You then have migration of your ascarids within the host. So this migration can go to liver, lungs, also can develop into the small intestines. It's been noted that you can have migration go, across lungs to the airway to, we've even noted eyes as well. And so this is why it's really important too, that even with humans that we deworm our pets, not only for their sake, but for us, so that we don't get roundworms for ourselves or our kids, so that we don't have the same stuff happen to us. So, and so Toxascaris is different though. So then Toxocara, that it does not migrate outside the intestinal tract. Okay. So Toxocara is the only one out of those two that does migrate all over. So that's important to note. So our ascarid eggs are passed in the feces of your infected patient, so your dog, and seen, and are found in fecal contaminated soil. And then we we also have seen that we can have an intermediate host as well. Anyone have an idea of what that intermediate host could be? It's kind of an accidental, maybe, intermediate host in the soil.
Sorry, you broke up. Which one are you asking about?
So Toxocara canis is a basically excreted right out into the environment, is broken down into the soil then after it's excreted. And so after that, it then continues on to its life cycle, right, until it's then ingested again. But it sometimes can have like an accidental intermediate host once it's in the soil. So does anyone know what the accidental intermediate host is?
Maybe a worm. Like
Isn't it human?
Yeah. I mean, sure, I guess it could be humans, but that's just it's not really an intermediate host because
it's already in the soil, so you would think.
I guess the accidental intermediate host then would be if a dog ate us, but like ate our GI system. So the intermediate host would be that like somehow the dog got it from us, right? So
Okay,
you're
I gotcha.
right, it's the earthworm, right? So yeah, like the earthworm ate the soil and then either digested then the soil and got rid of it, and then the dog ate the soil again, or the dog ate the earthworm, right? So kind of interesting when it comes to that. But no, that's perfect. So so the geographical, so I know you guys were asking about Taxa ascaris and like what the difference is and where like Toxocara and all of that. So there's not, there's just more of a prevalence over one over the other of just which one's more common and everything in certain areas, I should say. So it just depends on geographical area of which one you see more prevalently. So they're both roundworms, right? But it just depends on where you are at that you see one over the other. So let me see if I can find a map really quick to see. That is not. That is heartworm. Oh, here, intestinal parasites. So I don't know. Let's see. There's a lot of intestinal parasites in Maine, or I should say roundworms in Maine, West Virginia, Indiana, and South Dakota, if anyone's in there. But this is a really bad map. It doesn't tell you. It doesn't tell you which one is where, like which one is which. So that was a non-helpful map. Anyway, but it just, but Toxocara canis, it is more heavily present. Sorry, I can't talk. Than Toxascaris. So you probably will see that a lot more frequently. Just know that Toxocara itself is the one that migrates and does all the dirty work as well. So, okay, so pre-patent period for roundworms. So what is our pre-patent period for roundworms itself? Like how long does it take for adult or eggs to develop into adults?
2 weeks.
Good. And then how long does it take for them to start producing additional eggs to spread into the environment?
Is it 4?
Good, good, perfect. So like that whole life cycle. So say you have a puppy from beginning of age, like them from the day they were born to the time that they are spreading to the environment, right? They would be 4 weeks of age. Yeah, roughly. So it makes sense when you have that 4-week-old pot belly animal, right? So very good. Okay. So Tricharis vulpus.
Whipworm.
I know, I love them.
We have a song at work for them.
Oh yeah, I wonder what it is.
No, you'll laugh.
Why?
You know the Whip and Nay Nay song?
Yeah, I'm surprised that's the song.
Mm-hmm.
Anytime you can sing that song, right?
Yeah.
Anytime.
My daughter didn't sing it.
Right. It's great. I mean, any way to have fun in your day, like do it. That is how it should be done. So, so what is so amazing about Tricharis vulpus, other than these are probably the easiest to be able to find?
Is that they survive like a really long time in the environment.
Okay, yeah. Yep. And they have a really long pre-patent period too. I think it's long.
Isn't it? It's like 90 days, isn't it?
Yeah. I think that's long for worms, at least, like intestinal worms. Where do these guys live in the GI tract?
Large intestine?
Yep. Specifically where? Where do they like to hang out?
Cecum.
Yeah, definitely. Like to hang out in the little like break area, right? Cecum. So what do we notice? Like what is a huge telltale sign that this animal might have whipworms? Like, oh, this animal's having these symptoms, maybe has whipworms.
Mucus in the feces.
Okay, maybe. What else?
They have really significant weight loss and they can even become anemic.
Yeah, why anemic?
I've had it explained to me before by one of the iodets. Can't remember how she told me. I just remembered that they can cause significant weight loss, anemia, sometimes even like a hemorrhagic
Yeah.
view.
Is it
Right.
because the whips take a lot of the nutrients?
Yeah. But you're onto something with hemorrhagic what?
It's like a hemorrhagic like diarrhea,
Yeah.
like really bloody stools and a lot of mucus too, and they can become anemic real quickly if it's not treated.
Yeah, absolutely. So, okay, so say you have a your GI system, right, is bleeding. And you're not sure where in the GI system is bleeding, right? If it is melena, can you tell where in the GI system it's bleeding based on if it's melena?
Isn't it higher?
Good. Why would it be
in
higher?
Because it's melena is darker when it comes out, so it's gone through more.
Okay, so it's gone through more, meaning it's like been digested.
Yeah.
Good. And then if it's frank blood, it means that it's coming from the large intestines and that it is just coming from the exit points, right? Or the lower of the GI tract. Yeah. So if you're getting frank blood, you can then say, oh, maybe we have some sort of parasite that lives in the lower GI tract, right? And putting everything together with weight loss and all of that, sure, you could have a tumor that's living in the GI tract down there, right? But if it's a young puppy or whatever, like why look for zebras, right? So let's do a fecal first, right? So absolutely. So and especially if there's that anemia that's in there and stuff too, they're taking all those nutrients out and all that stuff as well. Like it's all leading to our whips. So very good. Awesome. And whips we see a lot of whips. So wonderful. So keep that in mind. Your melena and your frank blood. That's the fun part. It's like putting all that together. So what do whipworms look like?
Footballs with bipolar plugs.
Yeah, absolutely. And what's another parasite that looks kind of like our whipworms but isn't a whipworm that people sometimes get confused with?
Okay, I may be totally off. Is it the fasciola that kind of looks?
Yeah.
Okay.
Mm-hmm. Mm-hmm. Yeah, I was thinking capillaria as well, but yeah. Okay, so so we were talking about how the adults begin producing eggs between like 74 to 90 days after they are the animals initially infected. But whipworms, once you have that infection, like gone, like really producing through, your females can produce more than 2,000 eggs per day. So they can do some major damage once they actually reach that life cycle. So that's why, yes, like you were saying, Emily, they can become anemic and, you know, emaciated and all of that too. So it can get pretty bad. Awesome. So I'm gonna kind of run through some of these so we can get to.
Can't those eggs survive like even years in the
Yeah.
throat?
Yep. Because when you guys look at their outer shell, their cell membrane, those things are durable things, right? That cell membrane is pretty enveloped, right? So all right, so canine neosporosis. So did you guys talk about this in school? So you guys probably talked about this for large animal, or neosporosis itself is something that we see in obviously we could see it in dogs, but we also see in herbivores as an intermediate host, specifically in cattle. So so this is what type of parasite? Is it a nematode? Is it trematode? Is it a cestode? Is it a protozoa? Is it a, well, I don't know. Anyone? Any guesses?
Protozoan.
Good. It's a protozoa. Very good. So this actually is really important. It actually causes neuromuscular disease in our dogs just worldwide. So again, especially in other countries, happens quite frequently. Even here can happen quite a bit. So especially when we have those patients that come in and it's like, we're scratching our heads trying to figure stuff out, especially when it's like you have a neuro patient and you're like, I have no idea what's wrong with this animal. It takes a really good fecal test, you know, so to be able to look at them. So, so what happens is that we have these oocysts that are ingested, and they divide, initially divide into and invade the tissues. And then they basically live within those tissues. And then they start to inflame the tissues and form granuloma and necrose that area. And so you have many of them within the tissues, and for a long time, you won't have clinical signs. Once you do start having clinical signs, they will be just neuromuscular. So the disease is congenital to like infected puppies. So like if they have like a litter mate, they'll develop that paralysis as well in their rear limbs. They'll have like hyperextension. So beginning at like 3 to 9 weeks after birth, they'll have muscle atrophy and cervical weakness. They will have difficulty breathing and eventually will die. So like say mom has this and she then gives birth to all of her puppies will eventually die. It can be observed in dogs, obviously less than 6 months of age, can be infected. Adult dogs can be have the infection as a result of pregnancy too, or immune compromised animals can have it too. And then many times with these animals too, you will see that they will have cardiac issues due to just muscle tone atrophy. You'll also see some like dermatological issues and also pneumonia issues. So it just kind of depends on the country. Like I was saying, there's like, you know, prevalence of geographical area of where you're at, of like, you know, farming and stuff like that. In the United States, there's about 7% of dogs that were tested that had this neosporosis. Free roaming dogs tend to get this more, obviously, because they're around cattle much more. And then it seemed like in the areas of the states California, Georgia, Maryland, Nebraska, North Dakota, and Texas, they were found to have more prevalence. So, and so we do see that in adult cattle can become infected when they ingest the spore-related oocytes by presence of feed and water from it being in the soil with like dog feces and stuff. So of course it's important for farmers to have like clean food and water. And then let's see, what else do I want to say? Oh, trying to think. So for environmental resistance on this stuff, it can survive like months to years within the environment, just like toxoplasmosis or Toxoplasma gondii oocyst as well. Canine hosts, they can let's see it.
Question. So it pretty much starts with the dog
Mhm.
and that the cattle can get it. And it's kind of like a back and forth type of thing if you don't really clean the soil
Yes, yes.
and their
So,
feed.
yeah. So essentially, like the definitive host, I should say, are dogs, but cattle can get it too. So, so yeah, it's bad. But who it really affects essentially are the who it essentially affects the most, especially are like the, I wanted to say children, are the puppies or kittens that are born as well. So obviously the ones who get it in particular will still have they'll be immunocompromised, but especially since puppies and kittens are just born and don't have an immune system, they're even more immune compromised when they're born. So that is essentially a huge reason why they don't develop correctly right away and end up dying as well, like right away. So, so it's not good at all. So yeah, it's a coccidian. And had with an indirect life cycle of some sort. So I should say domestic dogs get it, coyotes can get it, obviously, because of being in the wild canine. And then possibly others, it's kind of hard to know exactly everyone since we can't like go and find everyone in the wild. So those are like the definitive hosts. I believe I want to say they were looking at foxes, and I'm sure wolves are potentially on that list, would be my guess. And then they have documented several herbivores as species that are like they say intermediate hosts, but they're more like those sub hosts that can also get it. So cattle, sheep, water buffalo, and then white-tailed deer that again are just kind of those ones that if we don't clean that area because there are droppings from the canines that they had contaminated stuff. So so yeah, that's the long and short of those guys. So a big thing that we can do for these guys is we can definitely try to give immune therapy to them. So, if we do have those guys that we could give like IgG to those who need immunosupport. We could do serologic testing on them, of course. So we've had some that we have had to test to see if they've had it. I'm not sure if any of you guys have ever had any that you thought might have it. But yeah, it's not fun when you get those that might have it. But yeah, that's a big one that I remember we had to really know. And then just kind of ways to help control it. So since it's a coccidian, what do we use to treat coccidia?
Panazerol.
Good, Panazerol, very good. And then typically, so we'll put them on Panazerol, and then we'll also usually end up putting them on like a clindamycin too as like a secondary, for secondary infection of anything, just because they're usually immunocompromised. And typically we put them on like a 4-week course of clindamycin, just as a make sure that they're nice and healthy. And then we just look for slow improvement with these guys, you know, to make sure that they're getting better with any kind of neurologic functions and stuff like that. So, and then we treat all litter mates no matter what, as well. So, doing passive range of motion exercises, massage, rehab aspects of things, all of that jazz. So, yeah. And that's kind of it on that one. But that one is a good one to kind of look over and know too. Any questions on that?
Is there anywhere I can find more information? It's not one I know at all. Like in my UK book, there was literally a paragraph that much on it, and that's it.
Oh my gosh.
Even though it is prevalent, I mean, it was seen in one of the practices I worked in while I wasn't involved, but we don't get taught it there. So
yeah, I just put up a really good website that I like. I had the app, and I mean the app was okay, but there's a really good website that has a lot of really great information, like pictures and all of that, and videos and stuff. And so it is like capcvet.org. But that has like literally, oh my gosh, like every single like parasite you can think of in veterinary medicine, and it goes over like all their guidelines, the species of every, you know, parasite, the stages, diseases, prevalence of it, like all these really great things, like the treatments that they recommend. It goes into really great detail on that stuff.
yeah.
And then
because I have noticed over here that like the veterinary technicians do way more than we used to do as veterinary nurses in the UK, and I'm really struggling with the whole thing because of this. I mean, I've done the VTNE once and failed it by I think like 15% or something, and because 90, I would say probably 70% of it I've never heard of before.
Yeah.
Which is ridiculous. So
no, I totally understand. And I mean, it just keeps growing, which is it's a good thing that it continues to grow, like that we're doing so much more. And we're finding so much more, which is the crazy thing. But yeah, I mean, it's just it's a lot of information. So yeah. But no, this is a really great resource to have it all kind of in one spot too. And I always think that pictures and videos help to kind of like put it all together. So yeah, I like that. And I just like to, like, for you guys, it's I think good to like kind of know what all of your guys' experiences. So that's why I ask you guys a lot of times, like, what do you guys like? Like, what do you guys do? What's different about what you guys do? Because that kind of pulls it all together. But yeah, for your guys' resources too, like this stuff is nice on the separate end of things, because then you guys can go back and look at it and be like, oh yeah, we talked about that. So when you read through like this website, it will help kind of piece it together. Like, oh yeah, we chatted about that drug and it treats for this or whatever. Oh, Beth drew that horrible picture, but now I can actually see the real picture, and it kind of, yeah, her drawing maybe wasn't that bad. Or whatever. But yeah, no, this is a great website to be able to look at it. They have like a resource library, videos, they have articles in there, and stuff too. So, but yeah, I would check that out. They even have like maps of which state has, you know, like heartworm really bad or whatever, or, you know.
Yeah, heartworm was one I hadn't heard of.
Yeah,
so
which is so crazy.
We don't have, and rabies being another one. We don't have rabies in the UK or in Ireland.
Yeah,
so it's like learning all of that as well. So it's good.
Which is crazy even for those who are in Hawaii too, because they don't have to deal with rabies either. So, and you know, when I was studying for my VTS in critical care, we had to learn about like snake bites and stuff. And I'm in Illinois. We don't have venomous snakes. So,
Yeah.
so yeah, I totally feel you on that because I'm like, I need someone's help. Like, what do you guys do for rattlesnakes? Because I've never even seen one.
Yeah.
So,
I mean, a prime example is coming in. I had to learn from scratch how to do read a blood smear. We don't do that in the UK at all. They rely on the machines, which is completely wrong. And so when I moved over, and of course I moved into an emergency 24-hour, which I've moved on from since, and I got completely lost because I wasn't able. They were like, "Come on, do them," and they weren't training me, so I had to do it all on my own back, kind of thing. So, yeah.
That's interesting. So did you go to school recently in the UK or were you in school?
No, I was qualified. I qualified in Ireland in 2012.
Okay.
And then I was living in the UK for 8 years where I worked and then moved over here in 2000. No, sorry. Qualified in 12. Lived there for 4.5 years, sorry. And then we moved here in 2017.
Got it. Got it. So,
but where I was in Saskatchewan, I wasn't able to do the VTNE there unless I went to the school for 2 years. So whereas I've moved to Alberta now and it's different. So
yeah, no, absolutely.
I don't have to go to school here. So.
Yeah, I mean, it's definitely a lot different than for you. Like a lot of changes since then. So no, this is really good then, to kind of catch up and see like, okay, I hope your new place is kind of helping you and guiding you a little bit.
I'm actually not working at the moment, so that's not helping either. So I broke my leg and it was really bad break. So I'm just literally out of physio. So
yeah.
So just getting back to it now.
Yeah.
So.
Well, at least you can focus on your leg and studying in the meantime. So then you'll be all fresh and sharp and ready to go. So
that's it. Absolutely.
Yeah. Awesome. All right, great guys. So yeah, we got some of our stuff done for the meantime. We can always come back and do some additional parasitology. There's so much to it. So we can always come back and do more. So check that site out because it'll be really helpful to you guys. But take some time off today and enjoy the rest of your day. Hopefully you guys don't have any more storms like I'm going to have for the next couple of days. It's going to be crazy here in Chicago, but yeah, enjoy the rest of your weekend. And I'll see you guys this week coming up. So take care.
Thank you and stay safe.
Thanks.
All right. Bye-bye, guys.
Bye.
Thanks. Bye-bye.